Hi there, my name is Jan Newby-Hempel. I'm the Nurse Navigator of the North for the IG Stewardship Program. I am here today to talk to you about the screening and approval process for IVIG orders. Before we get started, we'll just review the vision, mission, values, and philosophy of care as seen here. We would like to acknowledge that we are gathering on Treaties 2, 4, 5, 6, 8, and 10 territories and the homeland of the Dakota, Lakota, and Métis. Recognizing this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous peoples by knowing that the land and the traditional people of the land offer us. So today we're going to talk about the adult IVIG order set, screening the revised adult order set, screening pediatric IVIG orders, using the adjusted body weight calculator, process maps, resources, and work standards. All IVIG orders are screened against the criteria for the clinical use of immune globulins. It's a tri-provincial document between Alberta, Manitoba, and Saskatchewan, and should be utilized by the lab, the nurses through the IG Stewardship Program, and physicians who are ordering IVIG. So we'll start with reviewing page 1 of the adult IVIG order set. All orders need to have 3 patient identifiers. So there needs to be the patient's full name, their HSN, their date of birth, and then the second thing to fill out there is the site/facility, which is where that patient will be receiving their IVIG. The physician needs to indicate whether they are ordering 10% or 5% IVIG here. For inpatient and urgent outpatient orders requiring IVIG within 24 hours, these orders are to be sent to the local transfusion medicine lab for approval. For outpatient orders, they are to be sent to the IG Stewardship Program. There's some contact information for us here at the IG Stewardship Program. If you ever have any questions, we are happy to help and will do so to the best of our ability. Outside of our Monday to Friday hours, you are encouraged to reach out to the transfusion medicine physician on call if you have any questions at all about the approval process or whether you should approve an order or not. There's a space here for the prescriber information, which is important just so that in the case we need some clarification, we have a way to reach the MRP. And then blood consent does need to be obtained by the prescriber prior to IVIG infusion. This is the responsibility of the bedside nurse when it comes to an inpatient. And then for outpatients, we do at the IG Stewardship Program help facilitate obtaining blood consent to the best that we can to kind of help out the infusion clinics. For lab investigations, an ABO must be completed prior to initial treatment. However, historical ABO is acceptable. This again is the bedside nurse's responsibility to ensure that an ABO has been drawn prior to giving IVIG. CBC and reticulite count should be drawn as a baseline and then 7 to 10 days post-infusion for non-O patients, and then serum immune globulin levels for immunodeficiency patients only. For the IVIG order, the big things that have to be filled in this box is the diagnosis/indication, as well as the patient's height and their weight. So as I just mentioned, the diagnosis and indication does have to be filled out because that is what you're going to use to screen against the criteria document. For us at the IG Stewardship Program, we do require for our non-urgent orders the prescriber to provide treating specialist clinic notes supporting the diagnosis and rationale for IVIG, but that is not required for inpatient screening process. And again, as I mentioned, the patient's actual height and weight does need to be entered. And this is just so that we can use the adjusted body weight calculator to figure out their dose. All right, so there is a spot here that the physician can indicate a specific brand of IVIG. And then the next three little tick boxes have more so to do if the order is for a maintenance order. But essentially, if the patient is new to IVIG, a maintenance order that is new is going to only be approved for a maximum of 6 months. If it's a renewal request, it may be approved for 12-month duration, but that is at the discretion of our program. And then there is now a section that we'll talk about later on about having an option to taper. Just on the topic of maintenance orders, the lab can approve a maintenance order. It's just important to know that that maintenance order is only applicable while they are an inpatient. So if this is a new patient to IVIG, they do not have a outpatient order that exists already. When the patient is discharged, they will need new IVIG orders to cover them as an outpatient. If the patient already has an outpatient order prior to hospitalization, they are then able to go back to continue that outpatient order once they've been discharged. What our IG stewardship program does is us nurses, we follow the patient while they're in hospital and note how many doses they receive kind of in their schedule while they're an inpatient. And we notify the infusion clinics that they've received those doses and let them know how many doses they have left in their current outpatient order. And then continue the renewal process as we usually do. And then, of course, all 3 pages of the order set need to be signed and dated by the MRP ordering IVIG. All right, on to page 2. So it is the same at the beginning in terms of needing that name, HSN, and date of birth. And then the physician should indicate again here whether they want 10 or 5%. Box 5 is used to calculate the actual dose. This is based on the patient's adjusted body weight, which we will calculate using the adjusted body weight calculator. There's 2 options in this section, and we'll discuss the actual adjusted body weight calculator and these 2 options over the next few slides. The adjusted body weight is a calculated weight based on the patient's gender that is assigned at birth, actual height in centimeters, and weight in kilograms. Its use is supported by the National Advisory Committee. The only adult patients that you would not use the calculator for would be your pregnant population. So if you know that the patient is pregnant, you would want to reach out to the TMP on call to confirm what dose they would like to use. Sometimes, because if they're further along in pregnancy, a lot of their extra weight is actually due to baby. So they might pick a dose that's somewhere in between the adjusted body weight and the actual body weight dose. The links for the calculator can be found through the QR code that is actually on the order set, or it can be accessed through the link as seen here, and it's also found on the Sask Blood website. So the first step is to indicate whether the patient is male or female. Then you'll enter the height in centimeters. I just want to note that if the patient is less than 152.4 centimeters, we will still use for all adult patients a minimum height of 152.4 centimeters. Then you will fill in the weight in kilograms, and we'll talk a little bit more about that on the next slide. Once you've entered the gender, the height, and the weight, the calculator will then give you an ideal body weight for each patient. If the patient is either at or above the ideal body weight, it will then calculate a dosing weight, which is the adjusted body weight. If the patient's actual weight is less than the ideal body weight, a little alert box will come up instructing you to use the patient's actual weight as their dosing weight. What's really nice is that the calculator actually then puts that actual weight in the dosing weight blank there, so you can continue to use the calculator for the rest of the calculation for the dose. Once you have your dosing weight, then you can go over to the IVIG dose calculator section on the right-hand side here and select from the drop-down menu the grams per kilogram dose that's been ordered by the physician. So once you've selected the grams per kilo from the drop-down menu, you'll press calculate and it'll automatically calculate the IVIG dose and will also then round that dose for you to the nearest 5 grams. This is just an example here, so if the dose had calculated out to be 26.6 grams, it will round it to the nearest 5, which is 25 grams. In the drop-down menu, there are a couple numbers that are missing, for example 0.7. If for some reason an order was ordered for 0.7 grams per kilo, you would just have to manually times that by the dosing weight and round to the nearest 5 yourself. Okay, back to the order set. So if the physician has selected option 5A, they essentially are giving authorization to the IG Stewardship Program or the Transfusion Medicine Lab to calculate the adjusted body weight and the total dose in grams. They no longer have to put their prescriber initials in this little space here. As long as they've signed the bottom of page 2, that will suffice that they're approving this authorization. The physician does still need to indicate the grams per kilo dose that they want and how many days they want it over, whether it's an induction dose or a maintenance dose. And then if it's a maintenance dose, they need to include the frequency and how many cycles they're asking for. I just want to point out that there is still that recommended 100 gram per day maximum. So I've noticed that in this box, the physician doesn't actually then see the total of grams of IVIG that are being ordered. So if we do the calculation and it's greater than 100 and they're asking for it over 1 day, it is worth seeking out clarification whether that physician really does want that whole dose given over 1 day, or if they're okay to divide it over 2 days just to spread out that dose. If it's really excessive dose, like 185 grams to be given over 1 day, it is also worth a conversation with the transfusion medicine on call just to make sure that they support that decision of giving that much IVIG in 1 day. Once you've calculated the adjusted body weight and the total dose, you will fill that information in the screening and approval box on page 3, just as seen here, but we'll talk about this a little bit more coming up. If the physician selects option 5B, it essentially means that they're going to calculate the adjusted body weight, which should be filled in, and then that they're going to use the grams per kilo dose that they want and calculate the total dose in grams themselves. All this information still needs to be filled in the same way, and then we will still make sure that it was done correctly and that they've used the right weight to calculate that adjusted body weight, and then we will take that information and still transfer it into the screening and approval box in page 3, which again we'll discuss coming up here. So I am going to just jump ahead to the bottom of page 3, which is where the screening and approval box is, and just briefly go over the steps that are required to fill that out, as they kind of directly relate to the dosing and stuff that we were just talking about in the order set. So step 1 is just confirming that which percentage of IVIG has been ordered and whether a specific brand of IVIG has been requested. Just as a note, if 5% has been ordered, it does require TMP approval. And then if TMP is consulted for any reason, that physician's name should be included in the screening and approval box. In step 2, you'll just enter that confirmed adjusted body weight. So step 3, you're going to enter the confirmed dose, whether it's an induction dose or a maintenance dose, and that's just your total dose in grams given over how many days, and then approve for how many cycles if it's a maintenance dose. I've included step 4 here too, because if there is a required dose adjustment, whether it's due to the physician using the wrong weight or the dose wasn't rounded, or for whatever reason we've had to make an adjustment to that dose, step 4 is making that change and indicating it here as well. So the lab gets to kind of skip step 5 and step 6. That is more pertinent to our non-urgent outpatient orders in terms of that we need to make sure that there is a valid blood consent prior to approving the order. And then we would also indicate where the patient is going to be receiving their infusion and when that start date of that order is. The last step is just to put your name and your signature, as well as the date that the order has been approved. By putting your signature in this box, it means that the order has been screened appropriately against a criteria document and that all of the information in this box is accurate. Okay, back to page 2. There is now a specific section for toxic shock syndrome, which I will talk about in the next slide. Okay, so as you can see, toxic shock syndrome is a green indication according to the criteria document. It can be ordered as a single dose of 2 grams per kilogram adjusted body weight, or 1 gram per kilogram on day 1 and then 0.5 gram per kilogram on day 2 and 3. If they're using the single dose, it can just be ordered in section 5 under an induction/one-time dose. If they're doing the dose over the 3 days, then we would use the toxic shock syndrome IVIG dose box number 6 and fill that out accordingly. Just still making sure that we're using that adjusted body weight to calculate those doses. Okay, moving on to number 7 on page 2 is the tapering IVIG dose section. So essentially this is used more for our, again, outpatient, non-urgent patients where we have some clinically stable patients that may start a taper process. And this just makes it really easy to kind of come up with a plan and indicate that for the physician, and so that we understand kind of what the plan is going forward, and we can then work together to either just taper to a more appropriate dose or eventually taper off completely. So section 8 covers medications. So pre-infusion medications and preventative infusion measures can be ordered if there has been a previous reaction to IVIG. And to finish page 2, again, the physician needs to put their name, their signature, and the date and time. So finally, we have page 3. It's fairly straightforward. So again, the 3 patient identifiers should be at the top of the page, as well as the percentage of IVIG should be indicated. Our medications are continued here. So these are PRN medications that are acceptable to give if there is a patient reaction that is happening. In box 9, it identifies where to find information on anaphylaxis and severe hypersensitivity reactions and what to do in those situations. And then that is kind of the end of the actual order set. Then there is a section for nursing considerations that help with dose rounding and the smart pump information, as well as what to do if there has been a reaction. And then the screening and approval box there, which we had already spoken about. And lastly, just making sure that you have signed the screening and approval box and dated it, and that the physician has signed and dated the last page as well. So we wanted to include just a really simple example for the screening and approval process. So step 1, we've received the order. We're going to screen that diagnosis to the criteria document. We're going to ensure that the height and weight are indicated. So we would confirm that the 1 gram per kilo is appropriate for ITP. And then we're going to confirm that the adjusted body weight is correct. The physician has chosen option B in this order, so they have chosen to fill out the adjusted body weight. So we would just do a double check using that patient's height and weight as indicated above, and to confirm that that adjusted body weight is indeed 67.9, which you can see in the calculator is correct. So the third step here is to confirm that dose. So we'd have a look at our calculator. After everything's been entered here, you can see that 1 gram per kilogram is 67.9 grams, rounded to 70. So on the physician's order, they had left the ordered dose as 67.9. We would then go ahead and round that dose to 70 grams as per the adjusted body weight calculator. Okay, so once we've double checked everything, we can go ahead and fill in the screening and approval box. As you can see, we've got IVIG 10%, our calculated adjusted body weight of 67.9, our induction dose of 70 grams over 1 day. We did adjust the dose to 70 grams, and I guess in this situation, we consulted the TMP. The one other thing I wanted to just bring to everyone's attention when it comes to confirming the dose is if there's been less than 30 days since the first patient has had IVIG last, it needs to be approved by the transfusion medicine physician on call. The only exception to the 30 days is our ITP patients, which may require a second dose even within 48 hours. But again, anything beyond that one dose needs to be approved by the transfusion medicine physician on call. So I briefly just want to touch on some of the differences between screening the pediatric order sets compared to the adult, specifically in regard to the adjusted body weight calculator. So this is a really great little process map to kind of help guide you in terms of when you use that calculator and not. So if the patient is less than 10, we do not use the adjusted body weight calculator. We only use the patient's actual weight. If they are age 10 and older, then we move to the next criteria. So if they are less than 152.4 centimeters and less than 20 kilograms, then we again do not use the calculator. We use the actual body weight. In order to use the calculator, the patient does have to be age 10 and older. They have to meet that minimum height requirement of 152.4 centimeters, and they have to be at least 20 kilograms. So if they fit that criteria, then they can use that calculator. And then the only difference with the calculator is then how the dose is rounded, and we will talk about that next. So rounding pediatric doses is slightly different than rounding when it comes to adults. So pediatric doses are to be rounded to the nearest 2.5 grams, providing the dose does not change by greater than or equal to 10%. So just some really simple examples. There's an induction order, it equals 4 grams. If that dose were to be rounded to the nearest 2.5, it would be rounded to 5, but this would be a 20% change. So therefore we would not round this dose. And then the next example is the dose equals 13.5 grams. So if we were to round that dose to the nearest 2.5, it would be 12.5 grams. This would be a 7% change, which then therefore would be able to be rounded. With pediatric doses and rounding, when in doubt, just consult the transfusion medicine physician on call. They're your best bet to kind of make sure that you feel good about how you're rounding these doses. So I'm not going to speak great lengths about the screening process of IVIG orders in regards to the process maps. There are a few different process maps that do exist for our program that I would encourage you to have a look at the Sask Blood website. They're all available there and are really great resources if you're not sure kind of the right steps in terms of how to manage an IVIG order when it comes in. So here are some additional resources that are available on the Sask Blood website. It'll cover a lot of the stuff that we talked about today, but almost everything IVIG related can be found through this website. So it's a really great resource if you ever have any questions. That brings us to the end. I just wanted to say that if anyone ever has any questions, please feel free to reach out to the IG Stewardship Program. Our hours are 8 until 4:30, Monday to Friday, excluding statutory holidays. Any questions, concerns, even if you just need to know, hey, like, should I consult TMP, or should this order come to you guys? Should it come to us? Or just a general question about IVIG administration or anything related to IVIG, please feel free to reach out anytime and we will help you as best we can. Thank you so much for your time.